She was up to date on all of her vaccines, which is good. And when I first started at Dr. Gildersleeve's office, it was our very first few months of medical school. Very nervous to get started, but excited to get to see patients so early on.
This is Roberta. Roberta's a med student at UConn.
The CLIC program is the part of the curriculum that allows medical students to work with doctors in the real world from pretty much the beginning month of their medical school career.
It's just fun to look at medicine through their eyes again and see how exciting it is to take their first blood pressure and interview their first patient.
We have approximately 300 or so preceptors. The vast majority of them are primary care physicians in internal medicine, family medicine, and pediatrics, but we also have a small and dedicated number of subspecialists who want to teach.
I've been a preceptor for UConn medical students for 20 years. I always thought it was a great experience for medical students to get out of the lecture hall or the hospital and see offices and see where people worked and did primary care, or in my case, pediatrics, out in the community.
It's really nice because you get to match what you're learning in the classroom to what you're seeing in real patients in the clinic and kind of start to develop those clinical skills.
CLIC is not only a place where they get to practice, but it is their home. Literally a place where they can ask questions, make mistakes, and learn from them in a supportive environment.
I feel like it is one of the highlights of my week normally, getting to come somewhere where I feel comfortable, where I know the system.
I'm very proud to say that when we talk to residency directors, folks who take in our graduates for their next stage of education, they'll consistently tell you that UConn students are 6 months ahead of the curve of how to really interact with patients.
Do you like going to school, seeing your friends? That's something that I really value, is being able to build those relationships with patients and kind of seeing how Dr. Gildersleeve is able to build trust with her patients.
I feel like it keeps me excited and motivated to keep learning as well, which is fun for me. I love that part.
Their time, their expertise, and their welcoming of students and their participation in learning is invaluable. We literally could not do this without them.
I'll definitely be a preceptor until I finish practicing. It's one of the most fun things that I do.